Thank you, Governor. Good afternoon, everyone. Once again, I want to thank you all for continuing to tune in and doing such a great job following our public health guidance, as well as for being such good ambassadors for us by sharing information with the people in your life. Let's help continue to make sure that these messages get out, that we encourage each other, and continue to hold on and following the guidance that's there. I also want to publicly thank all of the staff who worked to make the self-checker online tool that the governor spoke about accessible to Rhode Islanders. Across state government, folks have contributed to making this work, and of course also at the Rhode Island Department of Health. It's a tremendous tool that is available that we want to continue to offer to everyone. To get into the numbers, we have 365 new cases with a total of 5,841 cases. As the governor mentioned, we unfortunately have 10 new COVID-19 associated fatalities in Rhode Island. The age distribution for these 10 people is more or less consistent with the age distribution that we have been seeing for other COVID-19 fatalities. There were 2 people in their 60s, 1 person in their 70s, 4 people in their 80s, 2 people in their 90s, and 1 person who was older than 100 years old. We want to extend our condolences to those families involved. 6 of these people were females, 4 of them were males, and of these 10, 8 were nursing home residents. Some additional data that is accessible on our data dashboard regarding the 365 new cases in Rhode Island is that there are 270 COVID-19 patients in Rhode Island who are currently hospitalized. 71 of these 270 people are in intensive care units, or ICUs, at hospitals in Rhode Island. In addition to sharing these data points, I want to pass along a few quick reminders that help guide us in seeing how we can continue to take care of ourselves during this COVID-19 unique and unprecedented time. Last weekend, Dr. McDonald talked about the need for people to continue to seek routine medical care, such as pregnancy care, checkups for babies and young children to continue to get their vaccinations. It's also important for people to remember that if you have dental concerns, your oral health providers are still there for you. Many dentists are using telehealth and can help you over the phone. And of course, if you have a dental emergency, you can call so that you can see a dentist in person. It's also important to remember things you can do at home to keep your mouth healthy, like brushing, flossing, and drinking water instead of sugary beverages. While I'm talking about oral health, I want to thank the dental community, the dentists, the dental hygienists, the dental assistants, and office staff for your partnership through this. We can be proud of our Rhode Island dental community, which has always put safety first through an emphasis on strict infection control. While many of us are just starting wearing masks, just getting started with that, this has been what we've seen our dentists do for many, many years. So I'll finish with noting that it's wonderful that it's sunny outside, and I want to provide some guidance to people who are going to be outside today, acknowledging the 50th anniversary of Earth Day, or who will be outside in the coming weeks and months. Rhode Island does have the 5th highest rate of Lyme disease in the country. On top of that, we had a very mild winter. So there are many more ticks than usual that have likely survived until spring. And this means that 2020 could be a notable year for tick bites and Lyme disease and other diseases. But have no fear about that. It's something that we are used to. We don't want that to discourage us from being able to get outside safely and appropriately. If you are feeling cooped up, if you're thinking about getting outdoors and going for a walk in a place in Rhode Island where it is permitted, it's critical to remember to take measures to protect yourself and your loved ones. The 3 keys are repel, check, and remove to help prevent any of these tick-related illnesses that I'm referring to. Repel means keep ticks off of you, your children, and pets. Avoid wooded and bushy areas with high grass and leaves. And if you're going to be in a wooded area, social distancing appropriately. Walk in the center of the trail to avoid contact with overgrown grass, brush, and leaves. Check means check yourself, your children, and your pets for ticks. Taking a shower as soon as you come inside if you've been in grassy or wooded areas. A full body check of yourself and kids is important in being able to do that. And then remove. Remove ticks from your body as well as from children. You can use a set of tweezers to remove the tick. Grasp the tick as close to the skin as possible and pull straight up. And if you don't have tweezers, you can use fingers with a tissue or rubber gloves. As we continue to respond to this COVID-19 pandemic and look forward with the governor's guidance and a tremendous team on reopening the economy and figuring out ways to achieve our new normal, we want to make sure that you are all equipped on how to do that safely, but to be able to enjoy the beauty of Rhode Island, particularly on days like today, our Earth Day. It's important for us to be mindful of all of the things we need to do and to continue to do to keep ourselves healthy and safe, as well as our family and loved ones.